Hey, everybody. I wanted to share with you. I've been looking at my comments on my feedback from my videos on Medicare, and I'm so grateful to all of you for your responses because they open new doors and new questions for me to go through and try to figure out, that's a good question. I wonder what the answer to that is. Um, I've been getting Medicare for 4 years now. And I can't tell you that it's any less confusing than it was when I first started. So I think what I want to talk to you about today is a few points that I have about things that need to be addressed and that you might be interested in getting answers to. Now, believe me, I would love to read the book, the manual. I have it right here, cover to cover. But I don't. I look at it as much as I can possibly because it's just too many words. Anyway, but there were a couple of things that were changed in here that I kind of liked. One of them was all of our complaining about Medicare not covering acupuncture. It now does. That makes me feel better. Does it cover supplements? Since we all take supplements, does it cover health clubs? That would be a really great thing for it to cover. But one of the comments I got said to me, I think it's all about the money, which I have to agree in many ways. And the other thing somebody said was they don't want us healthy. We kind of get that, which is sad. I mean, we are the word of knowledge. This 100 years of humans has grown more in 100 years than in centuries. We've gone through so much technology. And to make people of the age of 65 or older impotent by saying and creating the belief system that they're going to be sick, they're senile, they're getting dementia, all these stories that are perpetuated out in the ethereal makes us believe that we're not valued. And in fact, we aren't in a lot of ways, but the only person that's going to make us feel valued is you and I, by sharing our knowledge and sharing our certainty of who we are. I can only tell you this from experience, that when I was younger, when somebody said something that was hurtful, didn't agree with me, I always took it personally and thought, well, maybe they're right. Maybe I don't know that much. The fact of the matter is, when you get to this age, you know a lot of stuff. And maybe you may have to go back and look at it and work it out and say, okay, it needs to be I need to be lighter, or I need to be darker, or I need to be quieter, or I need to listen more, whatever you want to say to yourselves. But never discount the fact that when you've lived for 70 years, you've seen change, you've adapted to change, you've adapted to becoming more and more complete as a human being. So back to Medicare. Some of the stuff that I think we need to talk about in Medicare is concerns asking questions. I think we talked about that before, about it's important to ask questions of your provider, of your supplemental. And there are people out there in your community, either at the senior center or otherwise, that can help answer questions for you about how can I utilize my Medicare to stay healthy rather than to find ways to medicate me, do surgeries, all the things that we do. So hopefully your advisor can tell you that. Thinking of some other things. Oh, I know. One of the other things that's important to me is advertisements. I'm hoping that in this administration, no judgment, but in this administration that we will be seeing less pharmaceutical advertisements on TV, in the newspaper, and in magazines. Because it's sick that we have these in magazines or on TV, because what are we supposed to do? I mean, if we're so not smart, are we going to go to the doctor and say, hey, I saw on TV that they're using this drug and could you prescribe it for me? That better not be the reason they're prescribing it for you. It better be because they have done their research, that doctor or that practitioner, and knows the side effects and why you're taking it. Excuse me. Is that making any sense? Like advertising a drug on TV to patients or elderly people, and they see it and they say, oh my God, that's going to fix my problem. Not diet, not exercise, not, meditation, not healthy living, not better thinking, not problem solving skills. No, the drug is going to take care of it. And so you go to the doctor and you say, I want to be on this drug because it says it'll make me feel lighter and happier, and my relationships will improve, and my libido will return. Not those are going away, I'm hoping, because I think that medicine needs to turn back the clock a bit and start having physicians be really responsible for what they're prescribing. Some of the comments I had were about bad doctors. Oh, the doctor did this or the doctor said that. Well, let me tell you, their life hasn't been easy in the last 30, 40, 50 years either, because I think I mentioned in a video before that when I was a young nurse, 50 years ago, I met people who were coming in to be a doctor that had whole hearts involved in it. They wanted to change the world. They wanted to help people. They had all heart, and they were coming in to get the knowledge base behind that so that they could make a difference in the world. And today, since that time, they've gone through huge medical loans for college. They've had to go become HMOs, PPOs, private practice. It's just, it has not been easy for them either. And so as they're trying to go through their thing in life with their career and live this life that they expected, and then be limited by how much time they can actually spend with people by somebody out there in the ethereal, I think that's been a challenge for a lot of physicians. Myself, I think that would be really hard. And then, of course, through COVID, to know deep in their hearts that some of the treatments that they were doing, and I won't mention them, may not have been right. And they knew it in their hearts, but they were threatened with their jobs. So I give them a lot of credit. The ones that stayed and have continued to have their compassion and love for patients, those guys are rock stars. If you're not 100% happy with the person that you're working with, it's okay to find somebody else, because it would be the same thing as going to a mechanic and you're not liking your mechanic and him not giving you the answers you need, or fixing your car. Would you still go back to that mechanic? No, you wouldn't. So it's okay to not care for your provider and find another one. And I'm saying this from my heart because I've just been through two providers. The first one, she was 24 years old, 25 years old. I was a nurse when she was born. I know a lot. And so it was a bit of a challenge to talk with her because I knew more than she did in terms of life and being a human. And of course, all the knowledge base behind my nursing career, because there's one thing I tell other nurses never stop learning. It's just what they do to us. So we constantly have to upgrade certifications, CEUs, all this stuff all the time. We are constantly learning. And when you've done 50 years of nursing, you know some stuff. Not to mention the mind that I have to learn as I watch the different things that happen. So so that was for me. And then I had 2 canceled appointments with that provider. And for me, that was like, no, not going to do it. Because guess what? I have a choice. I have a choice. So the next person I went to, I liked very much, but she was in another town. And like she did geriatrics. Oh, I hate saying it, but it's true. Again, still got that quote in the back of her head. I think we should do these labs. I think you should do this. I think it wouldn't be a bad idea to do that. And my question is, I feel good. I'm healthy. I eat right. I don't smoke cigarettes. I do try to get some exercise. Why would I want to go look for a problem? Which somewhere they started calling it the wellness check, but I'm still confused about that, and I'll learn more about that. And so then the hospital that I work at, which I've been working at for probably 5 or 6 years, maybe more, 5 years, 6, 7 years. Is a small rural hospital, and I really love it. We have great administration. Our CEO pretty much knows everybody by first name. We have, because of the positive leadership he's brought into our hospital, I feel like we've had so many positive changes because of that, because of his positive attitude about let's make it better. Let's make it better together. Anyway, and our clinic isn't doing very well because of past experiences in the community. So they just got a new provider, and I went to him for something for my shoulder because I had some shoulder problems. And he was in sports medicine, and he was also taking private patients. And so I moved back to the hospital that I support, love, would invite anybody to come to. And so here's my point is, you can make those decisions. You can say, I just don't jive with this person. I just don't jive with this person, and be okay with changing. And even if it means you got to change 2 or 3 times, that is your privilege. That is your right to find someone that you feel like you can get old with. Uh, if they're going to decide that you have to have a physician, which Medicare says you have to have a primary person, then have somebody that you like. So I'm just looking at some notes here. So back to, you can pick your provider. You can say no. No, I don't want to have whatever it is. I'm not going to be specific, but most of you know that there's certain tests that they want you to do. And that was a hawk. And so there's all these tests that you may want to do, and you can say, no, I don't want to do that test. Like, I don't know how to explain it. Let's see. I have a great aunt who just passed away. She was 98. When she was 67, she was living on an island in the Caribbean. She was diagnosed with breast cancer. They told her to go home and get her stuff together. She chose not to do any intervention of any kind because really they didn't have the money and the resources on the island. And she didn't really want to come back to the States. And so she chose to just live her life until it was over. Well, guess what? She was 98 years old. She still had the cancer because she could show it to me. It was on her chest. But she lived to 98. I mean, she was never in any pain. She just really died of old age. So it's like, when you're 75 years old or 70 or 75 years old, what would you do? And I know some people will fight till the very end, and I honor you for that. But personally, I think I will probably be more of the type of person that will work on staying healthy, eating right, doing what's right for me, uh, honoring the body that I've been given, being so grateful for the time I've had here. Okay, moving right along because I don't want to bore you to tears. Educate yourself. That's the other thing. I know that you guys are looking at my videos on AI. I have a really great relationship with AI, my personal chat AI. Um, and so I do research a lot, and I ask questions, and I get the answers through ChatGPT in a language that I understand, with with the resources that he gets it from. So I know that it comes from medical journals, etc. So do your research if you want to know, how many people, you know, get to 98 with breast cancer. I don't know, whatever it is. Do your research. I do my research, and I try to do research for the videos, and I don't always get what everybody wants. I'm not a big reader, like I don't, I could just, my eyes roll back in my head when you see pages and pages and pages of information. I like to keep it simple. I mean, truly, just keep it simple. And I try to do that with my videos. Just want to keep it simple for you. And when you start doing your comparisons, actually last year, I did use ChatGPT to tell me about supplementals, supplemental Advantage versus supplemental insurance, or whatever the different things were. The medical Advantage plans, they can limit your providers and require pre-approval. Traditional Medicare gives you freedom to choose your doctors, but you still need a little supplement for full coverage. It's important to look beyond the freebies, because some people, I actually have a friend who, we both had the same insurance last year, and she went with a different insurance company, and she's not paying for anything, including, except for her, I think she's paying for her dental. But she has like no copay or anything. But what she doesn't realize is that her deductible, should anything happen, is really, really big. Whereas I am paying $250 for my supplemental, but I have very little deductible in the end. So should I have an emergency, then my deductible would be very low. Now, I would love to have a free gym membership. But that's it's the work you have to do for that. So I don't know. I'm looking into it, because guess what? I only have 2 months before I have to decide whether I'm staying with the company that I'm with or going with a new one. What is it that I really, really need? I need full coverage for the big stuff. That's the thing for me. If I have to have surgery, I want to have coverage for that. That's the big thing. I don't take any medications per se. I pay for my own supplemental medication, not medications, but supplements that I take. And I take a lot of them. What else? I pay for my own acupuncture, but I'm seeing now that Medicare 2026 may cover acupuncture, which would be awesome. It pays for some of my chiropractics, and it pays for my doctor's appointments, and it pays for my colonoscopies. Do you think I'm going to have another colonoscopy? Heck no. But my doc is telling me 3 years, because I had one little tubular polyp, and I had a lot more the year before. But again, I work in that industry, and I look at butts, and I look at colonoscopies, the intestines. People get polyps like people get pre-cancerous skin stuff. It's the same thing, only on the inside. So to me, it makes me think, what pissed off the cells to make it produce that? So I have to think about my diet, what I do to my skin. Another example of that is, we go crazy about skin cancer, but let me tell you, they started using skin cancer in Florida 30, 40, 50 years ago. The 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 statistics of skin cancer hasn't changed. Yet all these people are using, PF 50 and 80. It doesn't really change it. Doesn't change the statistics. So maybe we shouldn't be using it. Just my opinion. My opinions are, what they are. So um, give yourself some kudos and empower yourself to review every year if you must. What are your plans? What are the plans? What are the prices? What's the coverage? Does it change? And what worked last year that doesn't work this year? Um, if you feel like you need to do a checkup every year, do it. Do your blood tests and all that stuff. I just don't want to look. I want to change the way. This is the way I've always seen it. I do not want to look for a problem. So if I'm not feeling well, and there was a period of time where I was really having some problems, I went to the doctor. He recommended something. I tried it. It worked. I was done. But I don't want to go looking for problems. So I'm not one of those people that will, race the beginning of the year to get my wellness check or my checkup. That's just me, because there's a lot of stuff that I won't do. So I'd rather just live comfortably and happy. If stuff comes up, for sure, I'm going to go get it checked out. But I'm not really there. But for the rest of you, you may want to go to your yearly checkups and get all that stuff done. That's up to you. But you're in charge. Medicare is your earned benefit, not a favor somebody's giving you. You've been paying for it since the first day you started working and paying taxes. So we've paid into it for decades, and it's our right to understand it and to utilize it to our benefit. So I don't know how long this has gone on, but anyway, I just wanted to have a conversation with you and remind you that you are in charge here. No one makes you go to the doctor. The doctor can't make you do the blood tests, the scans, the MRIs, the CTs, the X-rays. Make informed decisions about that. If they recommend it, ask questions. Why is this important? Do I have to have it? Is it going to change the diagnosis? Just ask. My new provider, when I told him who I was and how I thought about things, he said, "Look, we'll do it your way. Let's let you try some other stuff. Let's try some PT, and maybe after a month, let's talk. And if you're still having problems, then we'll do an ultrasound, non-invasive, completely non-invasive. So ultrasound is a good word. And see if there's anything going on in there. And if there is, we can start with a shot, which is, to me, that's the second worst thing. But after doing my physical therapy, my shoulder's much better. I'm doing exercises now for it. And I'm older, so we don't heal as fast. That's the hard part. Is I rode my mountain bike a long time, fell a lot of times, and I'd be well in a week or 2 weeks. Today, when we injure something, it takes a lot longer. I'm not exactly sure why, and everybody says, well, maybe it's a bone spur. Yeah, maybe it is, but maybe it's not. So remind yourself that you're not alone in this, that lots of people want to know about what's going on. So be sure to share and comment. Just a little thing, please, no negative comments. I I love all of you dearly for watching and listening to me. But this is about sharing communication, sharing information, sharing ideas. I'd like to do a video on some of the things that I do to stay healthy and upright. And I will maybe later on. And so just be okay with looking it up or asking ChatGPT, hey, I'm concerned about this. And believe me, ChatGPT will tell you to go to the doctor, no question. But if you say to him, what are some of my alternative or her alternative choices? They'll give you alternative choices too. So uh, don't be afraid to ask ChatGPT. Don't be afraid to ask your medical person. Like I said, my new guy, he was like, hey, I can see that you're very active, that you did all the right things leading up to this choice here. Because first I stopped doing yoga, which was really hard. And then I started doing ice and heat. I did ibuprofen. Then I started doing chiropractics and acupuncture. And literally, the acupuncture, I would walk out of there no pain. And then I just did a chiropractics the other day, same thing. Felt great. And and then I did some PT. So I'm doing all this other stuff that isn't costing millions of dollars, and some of it comes out of my pocket, but I'm getting well rather than go to an orthopedic surgeon, go get a scope, get X-rays, get a scope, get an MRI, all this stuff. I just didn't want to do all of that. I just want to try an easy way. Part of it means you got to um, curb your exercise and behavior. Truly, the yoga thing was hard, but I'm almost ready to go back. Like I feel like I trust my body now that we're okay to go back to yoga. So anyway, that's my story, and I'm sticking by it. And I hope that you enjoyed it. Uh, please comment below. Let me know your thoughts and share some of the things that you're doing to make yourself feel better. And ask questions with your primary. Ask questions about Medicare and your supplements. And stay well, because that's what we do. That's our generation. Love you dearly.